I don't usually put a lot of degrees, but I put these degrees there just to emphasize one point. And that is that as a medical practitioner, what you do, you need to be trained and certified for it. Now, you don't have to put all the certificates as I don't put it, but there will be a very important guide, cover, and sort you out when you enter some of the challenges we'll soon discuss. Now, I put it to an AI to help me rephrase the topic, and he said, maybe you should call it Malpractice Maze, Navigating Legal Challenges in Medicine. Now we have AIs now trying to do better than human beings, and they are one of your challenges as you move through the medical practice. Now, we'll discuss this topic by going through these outlines and what is medical practice before you know what is malpractice, and therefore what is malpractice. What are the common legal challenges? How do we prevent medical malpractice? How do we navigate it when it does happen? And how do you move forward after it happens with confidence? Now, but medical practice and doctoring are a little bit different. Doctoring actually is an active act when the patient sits in front of you and you are administering the doctoring on the patient. A physician is a medical personnel that have had successfully structured training, has been assessed as competent, licensed by an authorized regulatory agency. Throughout this presentation, these colored ones are points for you to look at, highlighted to catch your attention. Now, this physician, as you see the picture there, has no face. It doesn't have that personal touch as a doctor. It's just like describing engineers. But when you say a doctor, there's a face. And this face is supposed to show concern, project confidence, project integrity, and project knowledge. Just by looking at the doctor, you're supposed to have a reassurance that you are in good hands. Therefore, a doctor is a person who is qualified to treat people who are ill. Now, he has to be qualified to treat people who are ill. The level of medical skills and practice differ. We have them structured differently in an academic environment and in a non-academic environment. We have the house officers, senior house officers, if you like, registrars, senior registrars, fellows of specialist colleges, then the consultant, then you have the super specialist. Then in the non-academic setting, you have the house officer, medical officer of different level, principal medical officer, and chief medical officers. Now, in all these areas, at every level, there's a level of care that you are supposed to give. And everybody at that level knows what this level of care is in that field. What I mean, a surgeon will understand and know how you diagnose an obstructed hernia, what you should do, how you handle it, what type of surgery you should do, how you should do surgery, every process. Now, this knowledge that everybody at that level should know form the basis of malpractice suits. The underlying, wherever you are, is clinical governance and audits. Clinical governance, part of it is an institutional responsibility that the physicians working under you are properly trained and have the skills. Is the responsibility of the institution, not just of the physician. So the institution has to look out. Are they having the training necessary? Are they sufficiently fed, sufficiently rested? Are they in the top position to perform well? Now, if the institution does not provide that, it's a big problem. So an audit means looking from time to time at what we are doing to know that you are doing what you are supposed to do, the way you are supposed to do it, and you're having the result that you're expected to have. Now, without these two in an institution, there's already a problem. And the level of health care points varies between primary, secondary, and tertiary. Now, primary usually requires specialists. and tertiary require highly specialized equipment and expertise. Now, we tend to mix this up now and then, but they remain what they are. When you are in patient care, there's always an algorithm which is based on guidelines. For any disease, there are guidelines which are systematically developed statements that identify steps to be taken that are evidence-based. What are the level of evidence and recommendations? From this guideline, you're supposed to develop point-of-care protocols that decide what do we do in this hospital based on the guidelines. Because all the requirements, all the things you need in the guideline may not be available at that hospital. And therefore, the doctors at that level put head together and say, this is how we do it in Usman Danfodio, Sokoto, based on guidelines and giving what we have and our local experience. And it should be patient-focused. You should know what the patient is expecting from this interaction. It should not be harmful. It should be sensitive to the culture. It should be transparent. It should not be experimental. Medicine does not allow experiment on patients. I think it would be good if I do it and therefore I did it. Medicine does not allow it. Is this what any reasonable doctor at your level would do? That is the question. Then communication. The patient has to be communicated. It's not your body. The greatest trust is when somebody sits in front of you and says, doctor, I am sick. He's giving you his life. And what you do, he takes it religiously. You need to communicate what you are doing. And this communication means that the patient must understand sufficiently what you are telling the patient to be able to jointly make a decision with you on the point of care, the level of care he wants, and for you to support the patient. Then there should be documentation. Now, every point of care has preferred management and alternatives. Let me give you the example of an antibiotic. For an infection, there are five situations you use antibiotic: preemptive, prophylaxis, empiric, definitive, and supportive. Most of what we do is empiric and definitive. Definitive is when you have the culture and you know what is the disease, what is the bacteria, what is the drug to give. Empiric is what we do most, and it's based on two principles: community knowledge of the infection and the response pattern, and therefore we decide first line and second line. Also, nosocomial, which is hospital-acquired infection, they tend to have more antibiotic experience and therefore tend to be more resistant. We also have first line and second line. Everybody knows this. So if you have a patient and you start empirical treatment while waiting for the result of culture, which you must have taken, the first line has to be what everybody knows is first line. You can't go and experiment with what you think should be first line in these patients. It's the same thing. What investigation should we do? And what consultation should we do given this case? Medicine has all these things well structured, well defined. Irrespective of the specific outcome with the patient, you should understand that therapeutic success is not the same as diagnostic accuracy. That you succeeded with treatment doesn't mean you were right. This is because the nature of drugs is that they do many things and they don't read your mind. For example, you give an antibiotic azithromycin for a bacterial infection that was in fact not a pneumonia or bronchitis but asthma. Azithromycin is a bronchodilator. It's not going to say because you gave it for infection, I'm not going to provide it because it's going to do that anyway. So the patient will get well. This will explain to you why many people give many patients a treatment and they get well somehow. But again, failure doesn't mean you were not right. The key thing is that did you follow it the way it is known? Did you take a good history? Did you examine properly? Did you make decisions the way you were taught and everybody knows you should do it? And again, the difference between a doctor and the other people that just give drugs and people get well anyway is that it's less harmful because he gives everything for a reason and understand the possible outcome. Now, medical practice as defined is a very complex and emotionally charged situation. both for the provider and for the patient. When you are, whether you are a healthcare provider or simply interested in healthcare and trust, it's important to understand fully what is the spectrum of medical practice, malpractice, and what are the legal proceedings. I'll try to give you in a succinct manner that you can understand. So, given what I have said in the precedents, you can understand now that medical malpractice occur when healthcare fails to adhere to the standard of care expected in their profession, resulting in harm or injury to a patient. This can be misdiagnosis, surgical errors, medication mistakes, failure to obtain informed consent. But the key thing is that the doctor has failed to adhere to standard of care, and that this resulted in harm. Those two things need to be there. The consequence can be devastating to the patient physically, financially, and a lot of long-term disability. So it's a serious thing. As I said, by the time a patient is before you, he has given you the ultimate trust. Now, the biggest legal challenge, therefore, in medical practice is that how do you prove that there's medical malpractice? You see, the doctor is giving the documentation, and is the one you are going to take to God. You are going to rely on his documentation most of the time. Now, so the two problems is this. You have to demonstrate that the healthcare provider breached their duty of care. They didn't give you care the way they are supposed to do, given their training and their level of care, and what any reasonable doctor at that level would have done. And not only that it happened doesn't mean it's already legally liable. You have to show that this breach caused the patient's injury or harm. So two things: there's a breach, and there's an injury as a result of that breach. And then you require an expert testimony. Now, this expert need to have a thorough understanding of medical standard and practices, obviously. Now, another challenge is this: how do you find a qualified expert who are willing to testify against their colleagues? That is one of the challenges again, because it's an open thing. It's not something you do in secret. It's not a secret information. You have to come to court physically, face your colleague and say what he did is wrong. How do you find it? Secondly, the opinions can be subjective and open to interpretation. Even though there are standards of care, sometimes it's not one, and people have preferences. And these preferences may weigh against the testimony given. Now, there's also a statute of limitation. Each country has its own law. In Nigeria, it tends to be 6 years. That if you have not identified the injury, taking the person to court before 6 years, once 6th year expires, you really cannot do that in Nigeria. This is the act that shows that quotes it. Now, to be able to emphasize it, let me give you cases. There was a case one. I was formerly a theater committee secretary for the NMA those days when we had trouble with the NMA, and we had to have temporary ones. And these are some of the cases we handled. One was a patient that a doctor collected money, booked for surgery for appendectomy, but went to another doctor who gave him treatment, and he got well. So he felt that the other doctor wanted to defraud him. The decision he made was not based on medicine and was going to court. So we had to come in to try to resolve it. And what we found out was the problem was actually communication, and we resolved it successfully. The other one was unsuccessful fertility treatment. The patient complained that she was treated, she didn't get pregnant, and the doctor had promised her she would get pregnant. Therefore, she needed a refund of the money, and we came in. Again, communication. Another thing, we had divorce to male examining of female, and we had cases of where the doctor was even attacked because he examined the breasts of the female, even though they were chaperones. That was lack of cultural sensitivity was the problem. The cultural sensitivity means If it is here where you should have understand the culture of here. It's part of medical practice to understand the culture of where you are practicing and be so sensitive to what they want and what they don't want, and negotiate so that you can do it, so that the patient doesn't have to feel debased, feel everything she believed in all her life should throw away just because he's sick. That is abuse. The patient, you need to negotiate how to solve that. One way is to explain to the doctor or somebody who is significant that you want to do this, and that one will give you permission to do that. Another way is to try to get a female physician to do that, just so that you keep the integrity and the cultural sensitivity of the patient. Now, in all these ones, we are able to resolve it successfully without going to court. And that is one of the key points. You have to have a situation and a team that usually come into this when it happens. Now, how do we prevent it? And again, because of those cases, one of the keys to prevent it is improving communication. Explain procedures, explain diagnosis, explain treatment option, be an active listener, respond to patient concern, and build trust and understanding between you and the patient. How do you prevent it? Implement evidence-based practices so that everybody will know this is how we do it. Use proven method and techniques. Follow established protocols and use better technology and equipment wherever they are possible. Again, you should have regular training and education. Be a lifelong learner to try to improve yourself, not because you want to show certificates or you have anything to do, just because you want to be assured that somebody has trained you and certified you in what you do. It's going to help you a lot when situations arise. So stay up to date on research and best practices, continuously improve your knowledge, attend conferences, participate in workshops. How many of us are here? Seminar, pursue advanced degree, and have certification. Now, when it does happen and you have to face the legal challenge, now you have to, the step you can take to navigate these challenges with confidence. One is that you need to document everything. Keep detailed records of all patients' interaction, including conversation, treatment, and outcome. Some people say document and document the documentation, all right, to emphasize how important it is. It can be crucial to defending yourself at legal. Then communication, again, is key. Be transparent with your patient that there's a problem, you don't have to lie. A doctor should demonstrate integrity. There may be consequences, but I usually say I don't mind anybody recording it because I don't see a situation where I'm going to say I didn't do what I did. May Allah not allow me to see that situation. But the problem is that when it does happen, own up there's a problem. Own up there's a mistake about the care. Make sure they understand their treatment option and have given informed consent. Be honest and upfront with your patient and their family. In this area, it does help a lot when you are upfront. People then they take a lot of things as kadara. And when you tell them what happened, the way it happened, how it happened, it tends to give more reassurance than when you lie and people discover it's a lie or they can prove so. It tends to generate annoyance. But again, if you have had somebody and you know you have had the person, it is always better to own up. But you have to do this with legal consent. Sometimes the way legality works is not the way the human emotion works. So you have to have legal consent. Because when you say yes to something, the law may interpret that yes as different from the yes me and you knows. So you need to have a legal consent. And provide them with all relevant documentation and information and be open to their advice and recommendation. Now, facing this legal challenge is not an easy thing. So always take proactive steps to document your care, communicate effectively with your patient, and work with experienced legal counsel. You cannot overemphasize that. In summary, medical malpractice is a serious issue that has devastating consequences. It is important for healthcare providers and organizations to take steps to prevent it. Key is improving communication and implementing evidence-based medicine and conducting regular training and education. If the legal challenges do arise, you should prioritize documentation, communication, transparency, and work well with legal expertise. Thank you. I hope this has been helpful. Let me take my TV.